Morning.
Hello, all, and thank you so much for joining me on today's topic, combating autoimmune challenges naturally. Very complex but important topic, and unfortunately, autoimmune conditions are just growing, increasing in number constantly. So again, thank you so much for joining. This whole webinar will be recorded, and you all will be getting a recording of this whole thing. You will also see a chat box. Please feel free to ask questions along the way. I will answer all the questions, however, in the end. Thank you so much. And if there's any problems, if you can't hear me or the screen is not sharing or whatever, please, again, feel free to add that into the chat box. I will check it periodically. All right, so let me start by introducing myself. I'm Dr. Hirani. I did my residency and board certification in family practice in Michigan. After that, I practiced for some time in a traditional family practice office and realized there was a lot of things I couldn't treat within the boundaries of mainstream medicine. Anyway, that's when I started exploring more alternative forms, and here I am today. My approach is I try to combine the best of both worlds. I use traditional medicine when absolutely necessary. My preference is to work with natural or functional medicine where we really try to look for the root cause, see what's going on in the body, and bring the body under better balance. I am also the medical director at Rose Wellness, and I've been doing this, for almost 20 years now, something I really, really enjoy. It's just wonderful to actually see people get to the root causes, hopefully most of the time in many other conditions. All right, so let's get started here. Like I said, a very complex topic. I will try to keep it relatively simple, but I would like to start first talking about the actual immune system and how it works. I think it's important to kind of understand that part so that you can understand why autoimmunity occurs. And if you can understand why autoimmunity occurs, then you have a little bit more control over your own autoimmune condition. Okay. All right. So the blood cells in our immune system help protect against harmful substances such as bacteria, viruses, toxins, cancer cells, as well as blood and tissue from outside of the body. Now, these quote unquote bad guys are known as antigens. All right. And the immune system protects us against these antigens by producing our army called antibodies, so that it can destroy these harmful substances. So you can see on the cartoon there, and thus Ned learned the dangers of accessorizing with antibodies. Antibodies literally look like that little upside down Y. So you can see Ned saying, hey guys, check out my new hat. And the rest of the immune cells are going, oh no, you've been marked, get away. Because as soon as that antibody accessorization has occurred, the immune system is attacking that particular antigen. So, of course, having a balanced immune system is extremely important, right? A healthy immune system is essential for normal growth and development and maximize longevity. So it can either, if there's a problem with the immune system, it can be underactive, where the immune system may not be able to adequately defend us from bacterial infections or other types of infections, leading to a weakened body, or in some cases, even life-threatening consequences. However, if the immune system response is activated without any kind of a real threat, or if it's not turned off once the danger passes, this can result in autoimmunity or an exaggerated immune/allergic response. So in an autoimmune condition, our body loses the ability to clearly differentiate between our own self tissue and non-self tissue, right? A foreign invader. So an example of that on the top there, intruder, destroy. And the poor little cell is going, what? But I'm one of you. And the other cells say, well, don't listen to her lies, right? So it's again lost that understanding of what is normal for the body versus not. Another picture here to illustrate a healthy immune response, as mentioned before, protects you from disease and infection. So on the left side, you see harmful things entering the body. They're being accessorized with those antibodies marked as bad. And then those immune system attacks those harmful things. In an autoimmune response, your immune system overreacts, and also attacks the healthy cells. So again, on the left side, you see the normal response. On the right side, that immune system is confused and starting to attack the actual healthy liver cells in this case, resulting in autoimmune hepatitis. So I don't like the term autoimmune disease. I think it's more accurate to say that my immune system is so proactive that it scrimmages with itself. So another way that the immune system can become overactive is that there's not enough Treg or suppressor cells. That's the one kind of all the way at the bottom right there, that little smiley face. So after these invaders have been destroyed, it's the suppressor cell's job to calm the immune system down and make everyone relax. It says, okay, guys, we're done our job. We've attacked the bad guys. We can rest now. So if there's not enough of these suppressor cells, then the immune system keeps on attacking and keeps on attacking, right? Contributing again to that overactive response. So you can see some statistics on this slide. I'm not going to go over all of them, but autoimmune diseases, when taken together, really become a huge health burden. And unfortunately, a lot of autoimmune conditions kind of present as these weird, hard to classify symptoms like inflammation, pain, swelling, fatigue, just general misery, right? And you go from doctor to doctor, you don't know what's going on with you, trying to do these various tests. And unfortunately, we don't even have a lot of tests, at least available to clinical medicine, to prove if you have an autoimmune condition. So sometimes in functional medicine, we're kind of guessing, well, you may have an autoimmune condition, right? And ultimately, it may not even matter as much as far as which autoimmune condition we have. It's just knowing that you have an overactive immune system, because then we can work on things to calm the immune system down and hopefully help you to feel better, right? Because there's not as much of all that attack going on. All right, so a couple of important statistics over here. You can see 50 million Americans have an autoimmune disease, comprising a major US health crisis. Autoimmune diseases are the top 10 killers of women under the age of 65. There's more women that get autoimmune disease compared to men. And it does represent the fourth largest cause of disability among women in the United States. So again, the basic cause, as we kind of mentioned in the earlier slides, is this immune system going haywire, right? Going wacko, for lack of a better medical term there. So the tissue that it attacks, that can really depend on various different factors. And we haven't really completely figured out why certain tissue gets affected, versus others. Part of it is genetics. Genetics can certainly play a role. For example, if Hashimoto's, which is autoimmune thyroid, runs in your family, then you're going to have a higher risk of developing hypothyroid, autoimmune hypothyroidism yourself. Okay, so genetics definitely plays somewhat of a role with this. So again, depending on what tissue it's attacking, that's the autoimmune disease you're going to get. If your joints are going to be attacked, rheumatoid arthritis. And celiac disease, your small intestine is targeted. Lupus, unfortunately, attacks tissues in many parts of your body. In MS, your nerve cells in your brain and spinal cord are attacked. Okay, psoriasis, it's the skin cells, etc. So what is the general sort of conventional medical treatment for autoimmune conditions? Usually the main therapy is immune suppressing medication. The cause is usually not searched for, right? Again, with the assumption of your immune system going haywire. So let's start you on a medication that's going to calm down your immune system. Of course, that makes sense. And I really wish that was a perfect therapy. The problem is a lot of these immune suppressant medications have multiple severe side effects. Now, don't get me wrong, they can be life-saving and help people get their life back, and even necessary for a lot of people, okay? It's not, some people absolutely need these medications. However, functional medicine provides another type of treatment, which is looking for the root cause, right? So for example, if you are standing on thumbtacks and you're in a lot of pain, well, there's two things you can do. You can take a bunch of pain medicine, right, to help you with the pain, or you can remove the thumbtacks. Now, the pain medicine can be temporary Band-Aids, but it's not the actual solution. The actual solution is removing the thumbtack. So similarly, kind of analogously with autoimmune diseases, think of it as like these different thumbtacks that are in your body. And our job is to look at or look for where those thumbtacks are, where they're coming from, and how we can actually remove them. Whoops, I'm sorry. There we go. Sorry about that. All right. So again, another little comic here. Medicine, you kind of see these on TV commercials all the time. Side effects includes this long list, Enbrel can lead to intestinal bleeding and kidney failure and depression and psychosis and diabetes and cancer and et cetera, right? So this person's saying, gosh, it may be easier to just stay sick. So again, weigh in the benefits versus the risk. And not everybody gets those side effects. And some people, like I said, do very well. But you want to explore. And even if you are on those medicines, I believe it's important to explore to see what those root causes are, because once you have one autoimmune condition, you're actually prone to others, because like we said, that base issue is the immune system. So for example, if you have Hashimoto's thyroid, your primary issue is not the thyroid gland. Your primary issue is your dysfunctional immune system, which has caused attack and therefore messed with the thyroid gland. So if we don't calm down that immune attack, it's going to start attacking other organs, making you more prone for other autoimmune conditions. So what are some of those root causes of autoimmune conditions? Well, you can see the slide can be a little bit overwhelming, and probably there's a lot more causes than what we just see on the slide alone. All kinds of things can trigger an autoimmune condition, unfortunately. Functional medicine examines the way the body functions as a whole. The focus is on finding that imbalance, right? That thumbtack in the immune system instead of simply suppressing the immune system. There is no one size fits all description. It looks different for everybody. And that's why when patients come to me with any kind of autoimmune condition, I really want to take a good history, detailed history, and really, address and try to look at all of their body systems so I can try to figure out what some of those root causes might be. And there may be more than one root cause. So for example, 10 people with autoimmune Hashimoto's thyroiditis may have 10 different reasons why they have it. One person, it might have been gluten that triggered it, and another person, it may have been glyphosate, which is a toxin, and yet another person, maybe mercury was the issue, and maybe in the other person, it was something like fluoride, all right? So again, finding those root causes of what triggered that immune system to go haywire is not always easy, but very important. So let's not get so overwhelmed, right, with all that stuff on the previous slide. Let's look at kind of the 5 most common triggers or categories of root causes. As you can see on the slide over here, the leaky gut, diet, toxins, infection, and stress. Now, studies have shown that genetic predisposition accounts for about 30% of all autoimmune conditions. But the rest, 70%, are due to environmental factors. There was a landmark study done in 2009 by Dr. Fasano who suggested that 3 things must be present for an autoimmune condition to develop. One is a genetic predisposition or a family history. Nowadays, unfortunately, we are seeing a lot more people without a family history getting autoimmune conditions as well. A trigger. That trigger could be a very stressful event. The trigger could be an infection. The trigger could be a certain toxin that you've been exposed to. Could be mold, could be Lyme, or and the third thing would be something called a leaky gut. And we'll definitely talk more about leaky gut in just a moment here. Okay. So again, these are kind of the 3 things I'm keeping in mind whenever I'm seeing my patients walk in with autoimmunity, or even, maybe somebody's come to me for something else. And if I see this pattern, or, I see somebody with leaky gut or a family history of autoimmune, you bet I'm going to start working on some, preventive things to hopefully reduce the risk and have that talk with my patient. All right. So what is leaky gut? Well, a healthy diet, you can see and kind of look at that picture a little bit over there. A healthy digestive tract lining, as indicated there, kind of acts like a selective sieve. It allows only those tiny particles, which is the good stuff, like minerals, vitamins, nutrients, to go through that gut lining to the other side, which is the bloodstream. And the bloodstream then carries these nutrients to the rest of the body through our circulation. Okay. That acts like a barrier. It keeps the larger particles or the bad stuff away, like toxins, fungi, yeast, parasites, large undigested food particles, waste products. All of those things don't cross that barrier, right? They kind of stay on the outside of it, out of the bloodstream, so that they can continue to go down the intestinal lumen and out of our body via the stool. Now, when the cell lining or the walls of that small intestine become damaged, this is the medical term for this is known as intestinal permeability. Now, all of a sudden, those larger particles, which don't belong in the bloodstream in the body, are crossing through. And this is kind of the layman term known as leaky gut. So in an intestinal hyperpermeability, you can see on the left side there where you have a normal lining, what should happen is you should have these tight junctions between those intestinal cells, okay? And those, again, prevent the bad stuff from going in. But in the case of leaky gut or hyperpermeability, these lining cells open up. And this allows the larger particles, as seen on the right side, like again, gluten, microbes, toxins, et cetera, to enter the bloodstream. You can see all that junk in the bloodstream. And the immune system goes, hey, what are all these bad guys? They don't belong. Shoot, attack, destroy, right? So the immune system already targets them as dangerous. They don't belong in the bloodstream. This signals a flood of immune antibodies. And if, a little bit here and there, not a big deal. That's what our immune system's job is. That's what they're supposed to do, and they keep us protected. But if something like this is going on continuously all the time or overwhelmingly, well, then yes, it's going to lead to a stressed immune system over time and allergic reactions. Okay, a hyper response to something that you shouldn't be hyper responding to, like a food, that you're eating. In a stressed immune system, it loses that precision in attacking the right invaders, and it sets off waves of attacks to fight in this desperate bid to defend itself, right? So it just really starts to attack that lining even more. So now our own immune system is attacking a lot of that lining. And eventually the body's own tissues become victim to these attacks, creating long-term inflammation and autoimmune processes. And, inflammation kind of is mostly a part and parcel of autoimmune processes in general. And this also leads to food reactions, right? If there's an undigested food that you've been eating that's crossing that barrier, that can lead to a food reaction. So if our immune system right at that gut area, it constantly sees, say, dairy, and it doesn't like this undigested dairy protein like casein, for example, it's going to keep attacking it continuously, again, leading to potentially an overactive immune system. What are some common culprits? Or causes of gut lining damage? Well, what's known as a standard American diet, which is a lot of processed foods, unfortunately. Processed meats, processed foods, sugars in the diet, artificial sweeteners, et cetera, additives, chemicals in our environment, including food dyes, infections, as mentioned earlier, gluten and other grains, food allergies, excessive medications or even specific medications, aggressive exercise, believe it or not, caffeine, alcohol, and chronic stress. All of these can cause leaky gut or hyperpermeability. Some common medications that cause leaky gut, as you can see over here, antibiotics. Antibiotics tend to destroy a lot of the good bacteria, which we'll talk about later on, which are needed in our gut for good digestion and vitamin synthesis. A lot of common pain medications like Advil, for example, can erode that mucosal lining of the stomach and small intestine, contributing to intestinal permeability. So if you have chronic pain and you're taking chronic Advil, that can certainly be one of the triggers for leaky gut, right? Acid reflux medication is another common one. It unfortunately hinders digestion and absorption, leading to nutrient deficiencies. And antidepressants as well can negatively affect those neurotransmitters, which are made by a lot of the gut lining. So yeah, it's just my leaky gut. All right, so we talked about leaky gut. That's one of those 5 categories. The other category we're going to be looking at a little bit here is toxins. So there's over 80,000 chemicals that have been introduced into our society since the 1900s, and maybe more now, since I did this slide, but at the time of this slide, only about 550 have been tested for safety. I'm sure it's not much more than that. According to the U.S. Environmental Protection Agency, about 2.5 billion pounds of toxic chemicals are released yearly by large industrial facilities. 6 million pounds of mercury are poured into our air every day. Okay. There was a report found there on that third pointer that found an average of 148 chemicals in our body, and those were only the ones that they tested for. And then also umbilical cord blood of, babies, just as they emerged from the wound, was examined for chemicals. And on average, they found 287 industrial chemicals. So you're doomed before you even come into this world, right? Things like Teflon and flame retardants. So we really, really do live in a very toxic world, and that's only increasing. And that's probably one of the biggest reasons why things like autoimmune diseases, cancer, et cetera, are on the rise, right? Because all of these chemicals, which are affecting our body just doesn't understand what to do with this overwhelming amount. So as mentioned in an article by Dr. Douglas Kerr, professor at Johns Hopkins School of Medicine, he quoted, "There's no doubt that autoimmune diseases are on the rise, and our increasing environmental exposures to toxins and chemicals is fueling this risk. The research is sound and the conclusions unassailable." So there is plenty of research on all of this stuff. I'm not going to go over all of these, but this is just some examples of research: BPA, mercury, TCE, pesticides, and different studies and how they've increased risk of autoimmunity. Heavy metals, an estimated 25% of Americans have some form of heavy metal poisoning. What these metal toxins do is they actually alter or change the chemical structure of our DNA. And that changes that tissue structure, right? So that damaged tissue is seen by our immune system as a foreign substance. It doesn't recognize that damaged DNA. All right, there's something called oxidative stress, which damages a lot of DNA as well. So our immune system, again, what is this foreign substance? I don't attack you, so I don't understand you. So of course the body then attacks that new foreign tissue, resulting in autoimmune conditions. Okay. And again, multiple studies have shown that these metals can lead to various different autoimmunities, as mentioned in that last pointer there. I just thought this slide was interesting and I put it down. Remember we talked about how women are more prone to autoimmune disease compared to men. And, I just wonder, you have to wonder, is it because women tend to use a lot more beauty products or skincare products compared to men, right? A lot of these skincare products have so many chemicals in them and heavy metals. There's a Canadian study done over here, tested 49 very popular beauty products for 8 different heavy metals. I mean, look at these findings. 100% of them had nickel in it. 96% had lead, 61% thallium, 90% beryllium. I mean, that's a lot of heavy metals, right? And just regular day-to-day makeup. I also thought this was another interesting slide about glyphosate. Glyphosate, the common name for that is Roundup, which is, the insecticide that a lot of our crops are sprayed with, especially gluten crops, just sprayed with all this insecticide. So you can see over here, this is frames of a video showing a lab experiment. In the first slide there, glyphosate was given to the person or given in that particular slide. And you can see, right at that moment, there's those beautiful blue nuclei and those green walls there, the beautiful tight junctions, nice and tight. And then 6 minutes, 10 minutes, and 16 minutes later, in just 16 minutes, a lot of those tight junctions had already disintegrated. That's quite significant. So sometimes, some of these crops like gluten and corn, for example, may not even be the actual gluten that's the problem, but it might be the glyphosate Roundup from it that's the problem. And you can test for these in your body, by the way. You can test for chemicals, you can test for glyphosate, you can test for heavy metals. So, how do you know you have these? You don't just have to guess, you can test for it. I had a patient that came into me who we tested her, and she, had a bunch of dry cleaning chemicals in her body. And she's like, gosh, I don't even give my clothes for dry cleaning. I don't understand how this could be. And then as we dug deeper, she said, well, yeah, my father owned a dry cleaning store when I was a kid and a child or growing up, and I would go hang out in the store all the time, basically, and work there and help them out. And so even though she hasn't dry cleaned her clothes in many years, those chemicals stuck in her from them. Anyway, the good news is we found out that was one of her root causes. We worked on it, and thankfully, she did improve. Yeah, another little comic there. Do you also eat with those masks on, right? Here we are spraying all our crops, but then we're putting the same thing in our mouth. Some of the greatest exposures come from the foods that we eat, the water we drink, the air we breathe, and the personal care products that we use. That's overwhelming, right? How can we get away from this? It's just our world is toxic. Now, in theory, our body should be able to process these waste products and toxins we're exposed to, and it does. Mostly our bodies are, can be pretty efficient and really help to clear a lot of this out. But, when it comes to a certain threshold, the overwhelming number of chemical exposures can cause our body to have a hard time keeping up. We can't always control those chemicals and toxicity that we're exposed to, but we can influence and encourage our body's natural detoxification and elimination processes. Okay, so we can help to kind of release or remove some of those toxins from our body. I'm not going to go over everything on the slide. Again, you will be getting a recording of all of this, but this is just kind of some tips on how to reduce exposure to toxins in your environment, clean up your air, your water, natural products, eat organic, etc. And also this slide kind of talks a little bit about how you can support just some natural, simple things. These are just simple ways doing on a regular basis. Regularity is key to support your body's detox processes. I will tell you, if you have constipation, chronic constipation, that is definitely something you want to address, because that's one of the ways, we remove waste from our body. So, lots of water so you can remove waste through, good urination. And then you want to make sure that you are having regular, daily, healthy bowel movements. These are just the very basics. So I want to capture this moment before the toxic chemicals do. All right, so we talked about leaky gut. We talked about toxins. This is the third common category, infections. So chronic infections, such as parasites, mold, bacteria, viruses, common viruses would be like the Epstein-Barr virus or the herpes virus, and Lyme. Unfortunately, these bugs are commonly found in connection with autoimmunity. They can trigger the development of an autoimmune process, a disease, through a process called molecular mimicry, and I'll definitely be talking about that in just a moment. They can also, however, worsen an existing autoimmune condition by triggering flares and increasing symptoms. Okay. All right, and then many of these infections can remain dormant in your body for many years and can even resurface in the times of stress. All right, so stress, yes, can be a contributor of making these infections alive again, if you will. I just wanted to point out one thing. Somebody said Roundup is not an insecticide; it's a weed and grass killer. Yes, absolutely correct. Thank you for correcting me there. But it is used in a lot of crops in our food. Okay, so what is this concept of molecular mimicry? This is a case of mistaken identity. The immune system reacts to self tissues and cells as if they were pathogens. So let's look at this slide here. Number one, for example, this particular bacteria, Streptococcus, infects a susceptible patient, right? Now the patient's immune system wants to fight this bacteria, so it makes T cells, which is one of the immune cells, and antibodies against the M protein of that Streptococcus, right? That's how it fights that infection. However, if a particular organ of that patient, say the heart, contains another protein, say myosin, whose structure is very similar to that M protein of the Streptococcus bacteria, then the patient's T cells and antibodies will attack both targets. It'll attack the Streptococcus and it will attack the patient's lookalike protein in the heart. Well, the immune system does a great job of clearing up that bacterial infection. The Streptococcus is gone, but unfortunately, the autoimmune process has now been set up and rheumatic heart disease develops, which is an autoimmune, heart disease process. Now, in the past, we saw a lot more rheumatic heart disease because people didn't get treated for strep throat. Now, there's a lot more awareness about that. And when you have strep, you would need to treat it because, yes, it can be one of the triggers for rheumatic heart disease. A more common example of molecular mimicry these days is actually for the example of gluten and many autoimmune conditions, particularly Hashimoto's hypothyroid. So the molecular composition of thyroid tissue is very similar to gluten. So as you can see on the right side over there, look at the shape there of gluten, look at the shape of casein, and then look at the shape of the thyroid tissue. Well, yeah, I can understand why the immune system might get confused between gluten and the thyroid tissue, right? And so then what happens is if gluten is your particular trigger and you keep eating that gluten and the immune system attacks the gluten, well, it also then attacks the thyroid tissue thinking it's the same thing. And about 90% of people with Hashimoto's hypothyroid have been, found in some studies to actually have gluten intolerance. All right, so what microbiome, right? That's kind of a buzzword, a lot being used nowadays, especially in relationship to COVID these days. So what is the microbiome? Well, trillions of bacteria, fungi, and lots of other microbes actually live in or on us. In fact, did you know that all of these bugs actually outnumber human cells by 10 to 1? So we're just a bunch of bacteria. For decades, this population was just considered a nuisance and a potential source of infection. But only recently, maybe in the last 10, 15 years, there's been a lot more studies and a lot more sort of, uncovering mysteries of this microbiome. And scientists have discovered that this is indispensable to human life. These microbes work together as quote unquote one self-organizing, self-directing organism, like a supercomputer with untold intelligence and insight into restoring our health. So all these sort of bugs or microbes in our gut and in the rest of the body, they're kind of constantly talking to each other, just like a supercomputer, helping the body do what it's supposed to do. It extracts information from food. It helps to regulate the immune system. These microbes also help to resolve inflammation. They help with communication pathways, neurotransmitters, hormones, etc., and help with repairing our natural defenses. So I kind of think of the microbiome as an organ of its own, right? Really, really doing a lot of different things in there that we still really don't know enough about. There's still a lot more research to be done. So how's the microbiome associated with autoimmunity? Well, this microbiome actually communicates with and trains our immune system and nervous system. Those bacteria are not there by chance. We've developed them from the time that we were born. And as we've been developing, they're actually helping to mature our immune system, particularly in the gut, but throughout the rest of our body. And again, numerous studies in animals and humans have shown that changes in our microbiome, known as dysbiosis, have been linked to many autoimmune conditions. So it's important to have the right amount of the right kind of bacteria in our gut. Dysbiosis is simply a medical term for an imbalance between that bacteria, where you have a lot more of the bad guys compared to the good guys, and that can lead to inflammatory bowel disease, obesity. Lots of studies, showing microbial imbalances associated with obesity or poor metabolism and autoimmune conditions, and others. That list actually goes on. Again, just a little pictorial here to kind of visualize the good versus bad bacteria. You can see those friendly, good bacteria, also known as probiotics. Those help to maintain the mucosal lining that protects the body's organs from microbial invasions, right? And also, I think of them as an army. Not only do they keep everything clean and healthy, but they push a lot of the bad guys or invaders out. So the more good guys you have, the more the bad guys are being thrown out. But if those unfriendly or pathogenic bacteria or yeast like Candida overgrow, that's known as opportunistic infections. Okay, so that's not that classical infection that somebody gets that you're scared about and you need to use an antibiotic right away. These are known as occult opportunistic infections hanging out in our gut or other places in our body. So what happens is these bad bacteria produce certain toxins, biotoxins called LPS, lipopolysaccharides, which then go and cause damage to that gut lining or other areas in the body, including the brain, blood-brain barrier, by the way. And anyway, they cause damage to that lining and leak through, again, triggering that immune response, right? Because the immune system tries to protect us from all of that. Can we impact our microbiome? Yeah, we absolutely can. The foods that we eat can really influence the bacteria in our body. They can play a pretty big role there. Our gut bacteria eat what we eat. Okay, so if we're eating more fiber, we're going to be growing more good bacteria. If we're eating more sugars and simple carbs, we're going to be growing more bad bacteria. Okay, and then certain medications, especially antibiotics, those can also kill a lot of your good bacteria and increase bad bacteria. Not just antibiotics, that's the classic one, but steroids and other medications as well. So not just medications, nutrition, but lifestyle changes, stress, et cetera. There are, again, a lot of different factors which can impact or alter this microbiome, either in a good way or a bad way. And there are things we can do about it. And how do we know? like I said, we can measure this. We can actually, there's no way that we know exactly the entire microbiome. Again, lots of more studies need to be done in this area, but we do have some snapshots, which can at least give us an idea through stool testing or through certain urine or breath testing to give us an understanding of what some of those bacteria are doing in there, especially in the large intestine through stool testing. Okay. So again, we talked about leaky gut, toxins, infections. Fourth category here is food. Okay, so food is very powerful. I really don't think that our society as a whole, including our medical society, gives enough importance and significance to food and its role in health and disease. Okay, I mean, think about it. The main reason we were designed this way is, we eat food to nourish our body, our cells, our tissues, etc. Now, of course, there's a lot more to food than that, right? There's emotional, there's cultural aspects to food, emotional aspects of food. There's just so much involved with food. But one of our basic physiological processes with food is to nourish our body. Okay, so you've probably heard the concept, food can be poison and food can be medicine, right? So you can pick whether you want food to be your poison or your medicine. So again, it can trigger inflammation and disease processes. On the other hand, it's one of the most powerful medicines that can create lifelong health. When we eat nourishing and healing foods, we can reverse the progression of our health condition, have fewer symptoms, feel better. Every bite put in our mouth has the potential to heal our body. And then, of course, common culprits like gluten, dairy, sugar are commonly associated with autoimmunity, but it really could be any food. I mean, you could develop an intolerance to something benign, like, I had a patient who had an intolerance to melon, cantaloupe. Like, I never see that, right? But she did. And, so she had to remove them from her body and she felt better. So, there's certain ones that are just more common that you just commonly see. Eggs is another one, nuts, things like that. And then there's some that are just not quite as common, but they can be a problem. And again, you can test for those as well. We'll talk more about that later. So food sensitivities, these can trigger an immune response, increase antibody levels, and worsen leaky gut. Digestive symptoms may occur with food sensitivities, like bloating, cramping, diarrhea, but that's not always the case. In fact, 50% of people or more have other systemic vague symptoms in relationship to a food sensitivity, and maybe no gut symptoms at all. Okay, so other common symptoms of food sensitivities include fatigue, headaches, sleep issues, hormone disruption, mood disorders, brain fog, joint pain. Okay, and again, a lot of these symptoms are common in people with autoimmune conditions. Food sensitivities can sometimes be hard to identify because they don't show up right away. So you could have eaten, say, that egg today, and you're only reacting to it 3 or 4 days later. So it might be hard to understand that the egg is what caused your reaction. So, food journaling can be helpful because you might see certain patterns. You go, gosh, every time I ate egg, 4 days later, I notice I'm not feeling good. So certainly food journaling can be a cheap way. Sometimes you can figure out what's going on, and sometimes you may not be able to. It can be tricky. So how do you know then if you have food sensitivities? Well, one way of doing it is testing. There's many different companies these days that do food sensitivities. Now, this is different from food allergies, okay? Those skin tests that you do at the allergist office. Of course, food allergies can also trigger. That is also a cause of, one of the reasons allergies occur is because of an overactive immune system. The only difference is in that case, your immune system is attacking outside stuff, right? Pollen, for example, or grasses and things like that. And that's known as an allergy. In the case of an autoimmune condition, your body is attacking its own tissue, known as autoimmunity, right? That's really the main difference between allergies and autoimmunity. So we can do testing to look maybe for foods that might be triggering your immune system. Another way to do it is something called an elimination diet, where you remove some of the most common food sensitivities from your diet for approximately 3 to 4 weeks. And then you start to add them back in, right? And you just see how you feel. If you're feeling a lot better when you do that, then you most likely do have food sensitivities to one of those eliminated foods. And then when you put it back in, you may be able to identify which food was the culprit. Again, logging these reactions, I always do recommend journaling them. You don't want to keep it in your mind. Can be helpful. Sometimes you're able to identify it this way. Sometimes you may not be able to. I put a whole slide on gluten intolerance because this is perhaps the most common food intolerance that tends to lead to autoimmune conditions. And as you know, there's an autoimmune condition called celiac disease. So you may or may not know, but in celiac disease, this is where, again, your immune system is attacking that part of your intestine through which you absorb gluten. Gluten intolerance is a little bit different. That part of your intestine through which you absorb gluten may be damaged for, a multitude of different reasons. So a couple of facts, more than 55 diseases at least, probably more, linked to gluten. 99% of people who have celiac disease or even gluten intolerance are real, it may not even be diagnosed. You may not even realize that's it, or it might be a while before you get that diagnosis. And approximately 15%, I think more, of the population is gluten intolerant. As you can see on the right side there, again, gluten intolerance doesn't only need to be limited to gastrointestinal symptoms. Yes, that's common, but 50% or more of people can have all kinds of other systemic symptoms, not including gut stuff, okay, as seen on that slide. So even the animals in our environment want gluten-free bread only. All right. So again, just a few tips. I'm not going to go over every single pointer on these next couple of slides, but you will get all of this, right? Food is medicine, some tips on what you can do to help, understand and restore some of these nourishing properties, right? So stop eating those processed inflammatory foods. Now, you don't have to aim for 100%, right? But at least 70, 80%, right? Make that, a big part of your lifestyle. We're human after all, we're going to get our treats. We want them, we need them and things like that. But overall, in general, that shouldn't be the norm. It should be the exception, right? And if you already are dealing with an autoimmune condition, you already know what your intolerance is, then it is a good idea to try to eliminate that food completely. Now, there are chances with a lot of those food intolerances that you can bring them back into your diet at some point. These are not necessarily permanent, but definitely a temporary way of calming down that immune system so things can be corrected in there. Okay, again, just some more tips and pointers here of how food can be medicine. Make sure you're nourishing that microbiome. Eat the foods that help grow the good bacteria. Yeah, what are you not having? I put the slide in here and it's, always kind of a joke with people with a lot of food restrictions and things like that. I mean, it's not easy having a lot of food restrictions, but there is also a lot that you can eat, and sometimes just working with a health coach or a nutritionist or somebody that's kind of trained in that can be very helpful for you to understand what you should eat. Because my concern always is I don't want you to get too restrictive with what you're eating. You want to make sure that you are still trying to eat, a full, complete diet as much as possible, at least. Something known as a 5R program for gut health, just in general. Like I said, leaky gut is one of those three big things, right, that you want to treat in order to treat your immune system. So healing the gut is going to be an important factor in anybody and everybody that's got autoimmune disease, or if you have the risk for autoimmune disease. Okay. Remember that about 60% of our immune system lies right under that single cell layer lining of our gut. So if that surface breaks down, that immune system is right there. It gets activated and starts reacting to foods and toxins and bugs and all these sorts of things, right? So you definitely want to heal that gut and heal up or reverse leaky gut. And hopefully you can reverse or reduce some of the progression of your autoimmune condition. So first R stands for remove those irritants. Second R is restore digestive function. Third R is reinoculate with good bacteria, repair that digestive lining, and rebalance your life. And again, how do you know what's going on? You can test. You can do stool testing. You can do breath testing. You can actually measure what your digestive enzyme function looks like, what your probiotics look like, whether you have leaky gut or not, gluten intolerance, things like that. So definitely you don't have to guess all of this stuff. There is tests available that you can do to know for certain. I kind of put a whole slide just about vitamin D on here because I think that's such a crucial immune modulator vitamin. Lots and lots of research studies done on vitamin D and its importance, not only in multiple different health conditions, but definitely in autoimmune diseases as well. Vitamin D alters the microbiome and integrity of that gut barrier. It has multiple direct and indirect regulatory effects on the immune system, including promoting those regulatory T cells. Numerous studies in MS, colitis, and others have demonstrated benefit with vitamin D. Okay. And I've given kind of one example of one study down there as well, a link to one of those. So I like to test levels of vitamin D and then dose your vitamin D based on your test levels. I also kind of put a whole slide over here just on low dose naltrexone, another wonderful, not really supplement, but medication that can be very, very helpful in this kind of a condition. Naltrexone, the full strength or full dose naltrexone was used in the past for heroin addicts. However, in a very, very low dose, 4.5 milligrams or less per day, it actually has certain pretty cool actions in the body. So those very small doses taken at bedtime actually increases endorphin levels. Endorphins are those feel-good hormones. These are naturally occurring substances that our body creates for a sense of well-being. You know, when you watch that really good feel-good movie and, you know, exercise in some people, that endorphin high that you get, those are endorphins. However, those same endorphins actually play a very important role in actually supporting and regulating our immune response, as well as in reducing pain and inflammation. So if you're lacking endorphins, if your endorphins are low, your immune system can go off balance. You can be much more prone to pain and inflammation, even a lot of neurological pain, by the way. Okay. And unfortunately, endorphin levels are frequently low in people with autoimmunity. Okay. So many studies, again, multiple studies have shown a wide range of health benefits using this low dose naltrexone for various different autoimmune conditions, not just the ones listed on this slide. All right. So again, leaky gut, toxins, infections, food and diet, and the fifth one here is stress, right? This is another huge category of potential autoimmune triggers or causes, root causes. So stress does matter. You know, our body does have a tremendous capacity to withstand all kinds of stress, physical, mental, emotional, and even chemical stress. However, traumatic and chronic stress has been linked again in many studies to the onset and progression of autoimmune disease. You know, stress is considered the gasoline in that fire of autoimmunity. A lot of my patients, you know, that have autoimmune conditions, one of the questions I ask them, well, tell me when this started and what was going on maybe in the year or two before it started. And a lot of those people, just like the research shows, 80% report some sort of a large emotional stress before that onset of the physical symptom, right? You know, a lot of people get sick easily when they're stressed out, right? So stress definitely plays a role. With our immune system. There's no doubt about it. Not just an underactive, but an overactive immune system as well. Stress, why does this happen? Well, stress releases the hormone cortisol. And cortisol does have an increased likelihood of reactivating various different dormant viruses, including Epstein-Barr. Cortisol can also cause leaky gut, damage to the gut lining. It can alter your microbiome, disrupt that bacterial balance, and much more. But these are just some common mechanisms by which it can, you know, contribute to autoimmune disease. Chronic stress does lead to a medical condition called HPA axis dysfunction. The common layman's term for that is adrenal fatigue. Again, also frequently associated with autoimmune conditions. Chronic stress does tend to trigger inflammation. So cortisol is the natural version of prednisone. And prednisone, we know that's an anti-inflammatory drug. So cortisol in our body also kind of regulates inflammation. So again, too much or too little of it is going to impact inflammatory regulation. Lowers your body's ability to heal. It can lead to overall oxidative stress. Can we measure how stress is impacting your adrenals in your body? Yes, we can. We can do saliva testing. We can do urine testing. The most common one that I like to use is something called the Dutch test, which is a urine test. Give us an idea of our adrenal function. And a lot of times, if and when, I do say if, because some people, it's very difficult for them to get, you know, stress under control in their lives, but something you want to absolutely continue to work on. But if and when these hormones normalize, the immune system will also hopefully start to calm down. All right, stress management. So the most important part of stress is really how we react to it. Okay. Studies have shown over and over again, it's not just the actual stress, but how we perceive stress that also matters. All right. So when we get a better sense of control over our stress, even if that stress is still present, if we get a better sense of control over it and how we're going to decide to react to it, we can make a difference. All right. And that's why daily stress reduction techniques, especially unfortunately in our stressful world, really do matter. Okay. Again, I'm not going to go over all of these things over here, but I've given you some tips on, some things you can do to help keep stress under control. So I just gave this as an example of the perception of stress, right? Again, it matters how you decide to react to it. So suppose you've got two people sitting in an airplane and this is the view they see. So one person might be looking at this view and going, wow, that's just so beautiful, so serene, so peaceful. I just feel so calm, right? And that person's got this just beautiful response and feels peaceful. And another person might be looking at that very same scene and getting all stressed out. Oh my goodness, we're so high up in the air. What if we crash? What if we fall in there? What if we die? And all these different things. And of course, they're going to be having a very, very different response, a chemical response in their body. They're going to be releasing a ton of cortisol, even though none of these things are actually happening. Right. And how many of us do that where we're kind of creating anxiety for ourselves that doesn't necessarily exist? So finding ways to overcome that and work on it's not easy, but very important. So how much longer do I have before I have to change to a healthy lifestyle? So a summary of the autoimmune matrix, right? Eat well, look for those hidden infections. Again, we can test for a lot of these, not all of them, but a lot of them. Possibly check for hidden food allergies, identify and test for gluten intolerance, heavy metal toxins, support your detox channels regularly, fix your gut through the 4R program, regular but not over exercise, address stress, practice deep relaxation, and sleep. Sleep is so, so, so important. And again, you don't have to do every single test out there. That's why the history matters, everything, when the trigger matters, what was going on around that time, right? So all of those help me to better understand perhaps where we want to start and then where we may want to go. Some people do literally need all the tests because there might be multiple thumbtacks. The key really here is to make it all a habit, right? This is not just about feeling better in the moment. It's about actually correcting the processes of these body, right? That ultimate goal is to stay well. All right. So again, autoimmune disease is not curable. I mean, in some cases, if you've just recently developed it and it's been very recent, you kind of do some things about it, it's possible you can turn it around and fix it and treat it. But a lot of times it's not, unfortunately, curable. Okay. We can try to send autoimmune disease into remission where it's no longer active. Your immune system's been behaving, it's been in balance, which is awesome. But then maybe some future trigger 5 years later, something like that can, major stressful event or an infection or something can re-trigger it again. Okay. And that's what I mean by it's not necessarily cured, but you can send it into remission. It can be very manageable. A more realistic goal would be, well, let's reduce the frequency and severity of flares. Okay. And that is, and remission, like I said, is possible. So again, the trick is not to be perfect, but practice doable and regular healthy habits. Consistency is the key. So even if I don't do something every single day, but doing it consistently 3 to 4 times a week, that has a lot more impact than if I do it something every day for 2 weeks and then don't do it for another couple months and then, do it. So again, you want to find set goals that are doable for you, and everybody's different. That's going to look different for everybody. You can absolutely work with a health coach to coach you through this and support some of these different lifestyle practices. And again, I think one of the main goals is to build what I call health resilience, right? You want to make your body more resilient. So once that balance has been restored, that next goal is to maintain that balance, regardless of those future stressors. Resilience is the ability to go out into the world and bounce back when faced with the same things that made you sick in the past. So in the past, if a particular trigger made you very, very sick, if your body's now more resilient, well, that same trigger may not make you as sick or may not even make you sick at all because your body has become stronger and has learned to deal with these triggers in a healthier way. Okay. So when we are resilient, we get sick less often and we recover more quickly. We become less susceptible to infections, allergens, and sensitivities. Again, I want to repeat, the ultimate goal is to stay well rather than simply feel better when the body feels unwell. Right? So go from unhealthy to healthy again. So, there is a lot you can do for your health. I'm not saying it's not work. Work is involved, like with anything else, to kind of rebuild back some of your health and kind of work on these things. And it can seem pretty overwhelming. But working with somebody and doing this in a more systematic, targeted way can, of course, make things easier for you. But hopefully, you do have some tips that you can actually start to implement right away after today's presentation and webinar. Again, I know there was a lot that we went over. You will be getting a recording of all of this, and hopefully you'll have a chance to digest some of these at a slower pace, and when you're rewatching it on your own. Hopefully you should get the recording within the next week or so. In the meantime, do we have any questions? I'll give you a couple minutes to just kind of type in any questions into the chat box if you'd like to, and I will start to answer those in just a moment. You have been a wonderful audience, by the way. I thank you for bearing with me through all this complex topic, and hopefully you gained something out of it. All right, let's see. Is soy healthy or not? That's a great, great question. I kind of call it good soy and bad soy. Okay. The good soy is the kind that raises good estrogens in your body, and the bad soy is the kind that raises bad estrogens in your body. This is a very simplistic way of putting it. It's, a lot more involved than that, but that's just kind of an easy way to think about it. So part of that depends on what you have going on in your body. So if you have an intolerance to soy, then it's not healthy for you, right? Because you are developing an intolerance, it's causing leaky gut and contributing to, these other inflammatory conditions and issues. But if you have a hypothyroid condition, lots of studies have shown that overdoing soy, not a little bit of soy, but too much soy can over time suppress thyroid function. If you have problems, with too much estrogen in your body, men or women, which estrogen can be a toxin, especially if it's a bad estrogen, then yes, even in that case, you probably want to eliminate soy. Okay. But otherwise, soy can be very healthy. It can be great for heart health. It can be great for bone health, for brain health. Okay. So the good soy is what I call fermented, unprocessed soy, organic tofu, miso, tempeh, edamame, those sorts of things. And what I call, quote unquote, the bad soy is more your processed, genetically modified soy, which is unfortunately seen in a lot of packaged foods, processed foods, and all over the place. A lot, people are eating a lot more soy than they realize they are. When you really start to look at those ingredients, you realize, yeah, I'm getting a lot more soy than I thought. So hopefully that answers your question. Again, it really just depends on your intolerances, your estrogen, and your thyroid, okay? And the type of soy you're eating. All right. What is a safe amount of daily iodine? Another great question. Iodine can be a double-edged sword. Iodine can be a beautiful mineral that helps with so many important things in our body, particularly thyroid and estrogen detox. But getting in too much of it can actually worsen Hashimoto's and cause you to go into a hypothyroid crisis. Generally speaking, some of this is somewhat variable, but about 100 to 200 micrograms per day. And again, that's a very, very general number. Some people will need more, and some people can't even tolerate that much. Thank you to everybody that said thank you. I hope that, this was helpful. All right, what is the relationship between cortisol and caffeine? Another wonderful question. Caffeine tends to raise, excuse me, it's the other way around. Yeah, well, actually, yes. Caffeine tends to trigger cortisol release in the body. And that's part of the reason why people with adrenal fatigue or just chronic fatigue crave more caffeine, because it's triggering cortisol, and cortisol gives us energy. But the problem is, I call caffeine, like stress, a whip. It's like, imagine you've got this tired horse that you're sitting on, and you want to go up the hill, right? There's two ways we can get it up the hill. We can keep whipping it, and it might make it to the top, but then what happens when it gets to the top? It completely crashes, right? The other way we can get it to the top is maybe, keep stopping along the way, give it a little bit of food and water. It might take longer to get to the top, but it's not going to crash. It's still going to be okay. So caffeine is that whip. It's just whipping you to give you energy, right? Energy, cortisol, 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 make more energy. The problem is over time, you will crash. All right. So it's not a great way to get energy. It's quick energy. It's not long-term sustainable energy. But that's what caffeine does. It basically triggers cortisol release. All right, thank you. Are you accepting new patients? Oh, I'm glad you asked this. Are you accepting new patients was the question. I'm really glad that you asked this because I am actually not accepting new patients currently. You can, certainly call our office and go on a waiting list at this point, but I'm not sure when that waiting list will open up. However, I do have two wonderful other physicians in our office that really practice very similar to me. So the stuff that I've presented today is not really different than what they would do as well. Okay, so functional medicine, this is basic functional medicine beliefs and principles. And so any functional medicine physician you see, whether it be elsewhere or those in our office, really should be doing a lot of these same things. Okay. Yeah, feel free to call our office if you'd like to, or, see a functional medicine physician. I really think people with autoimmune conditions that want to take charge of their health, I encourage you to see a functional medicine physician. I love getting the information out there also, however, and that's why I still give these webinars, because I really want you to have control. I want you to know that there are things you can do to help, get your health back. All right, let's see. Thank you again. Let's see. My daughter has recently been diagnosed with having lupus, so I'll pass this information on to her, and she can also benefit. Yes, absolutely. Please feel free to pass it on to whoever you think can benefit from this, because I know autoimmune diseases and the people that are dealing with it, it can be pretty depressing, right? And suffocating. Why can't I get better? Why can't I feel better? And so, yeah, just knowing that you can do something about it and take charge of your health, I think, is important information to know. All right, next question. Are healthy sugars okay? Coconut sugar, honey, maple syrup, or is no sugar the best way to combat inflammation? What a great question. I think if you ask 5 different people, they'll all give you different answers to that one. Again, sugar in and of itself is not bad. It's the amount that you're eating. Okay. Sugar is not bad. We need sugar. Sugar breaks down into glucose. Glucose gets into our cells. Sugar is important. If we went on a no sugar diet, we didn't get any sugar and we get hypoglycemic, we can actually die. All right. So it's one of those, glucose or sugar is an essential nutrient that our body needs. So it's not really so much is sugar bad. It's how much sugar you're eating. Okay. And the glycemic index of these different sweeteners. All right. So if something's got like pure refined sugar, for example, has a glycemic index of 100, so it turns into glucose very quickly. So it's going to spike your blood sugar, and your blood sugar can drop very quickly too. So in other words, blood sugar goes up very quickly in your body and drops very quickly. And so you keep getting this unstable up and down blood sugar. If you're eating a sweetener that's got a lower glycemic index, not so much of those spikes up and down. And the more blood sugar spikes you have, the more insulin spikes you have. And the more insulin spikes you have, the more inflammation you have. Okay. And then, of course, sugar can cause inflammation in multiple other ways too. So again, I think amount or quantity more than the type. But even within the type, the sugars that are the lower glycemic index, which is, some of the more natural sugars, but not necessarily all of them. And then the other thing about natural sugars like honey and maple syrup, for example, they have other benefits too, right? So it's not just about the sugar itself, but they may have other benefits. Like, for example, Manuka honey. Manuka honey in multiple research studies has shown to do a great job of killing a particular bacteria called H. pylori, and may even help with SIBO and other bacterial overgrowth, right? So you may actually use Manuka honey in those instances, but can it raise blood sugar? It can. So of course you have to do it cautiously, and people would say that have pre-diabetes or diabetes. So again, some of these answers are not always very simple. They have layers of complexity to it. But in general, yes, go more for the healthier sugars rather than plain refined white sugar. And even with that, kind of keep your quantity, at a decent level. And that's going to depend from person to person. If somebody is very sick and very inflammatory and very, has an extreme autoimmune condition, they really, really want to keep their sugar down. Again, not no sugar, but very low sugar. And that includes simple carbs and alcohol, right? All that goes in the same category. All right. Somebody said looking forward to future information sessions. Yes, please, stay tuned. There's lots of topics we do talk about: thyroid, adrenal dysfunction, hormone balance, digestive health, and on and on. Multiple topics. So please stay tuned. Sign up for a newsletter and you'll get more information on some of these different topics. The next question: are you accepting 15-year-old teenager? Unfortunately, right now in our office, we see 18 or above. However, one of our practitioners may be willing to see a 15 or 16-year-old. It really just depends. So please call our office, and actually let me go to the next slide with our contact information. Sorry, I should have had this up the whole time so you have our contact information. You can see our address at the bottom there, and our phone number. But yes, feel free to call the office, and they can always discuss with that other doctor to see if they're willing, after you give them some information, if they're willing to see your 15-year-old. And then somebody said, "Thanks, Dr. Honey. Your guidance has made a difference in my life." Oh, thank you, my dear. Thank you for that. I'm happy to hear that. All right, next question: are these safe fructose? Are these safe fructose alternatives? Erythritol, monk fruit, stevia, xylitol. Again, there's complexities, but if I had to give you just a general answer, I think most people do okay with those. I don't think necessarily it's bad for most people. Most people do okay with that. In fact, stevia and xylitol, for example, can have other certain beneficial, health things that they do as well. But again, it is one of those things. For example, if you have a fructose intolerance and IBS, then maybe you can't handle any of those, right? And again, it's the quantity or the amount that you're taking in also that matters. So not necessarily bad, and perhaps better. I would say at least definitely better than artificial sweeteners for sure, and better than refined sugar. Are you seeing patients with chronic multifocal recurrent osteomyelitis? Oh my goodness. Yeah, that's definitely a difficult condition. I'm sorry. Yes, but that is something that we can certainly deal with. Again, that is probably something you'll have to call the office, and maybe our staff will have to talk to the doctor to see how comfortable they feel treating that condition, because it's not a very common condition. It's a rare condition. But again, a lot of functional medicine is root cause, right? So, and when you correct a lot of these root causes, you're able to kind of fix whatever that symptom or condition or disease process is. And so a lot of those functional medicine concepts are actually very similar to each other. So yeah, please feel free to call the office and check. Is monk fruit with erythritol okay as a sugar substitute? Again, I think I answered that question earlier. Hopefully, I answered that question properly. All right, how to treat gut flares and improve gut health when taking probiotics, which seems to flare my discomfort even more. That's a great question. And frankly, that's a whole nother talk. I do a talk on digestive health. And although probiotics, lots of good things about probiotics out there, and everybody encourages you to take probiotics, there are a certain subsegment of patients that don't do well with probiotics. And most commonly, those are patients with SIBO, a condition called SIBO, small intestinal bacterial overgrowth. So, whoever this is that kind of asked this question saying that probiotics seem to flare your discomfort, if you haven't already, please go and get tested for SIBO. And you can even get tested by SIBO through a regular gastroenterologist, or in other words, through a traditional gastroenterologist. Of course, a functional medicine physician will do more related to that, but something important that you want to know. And if that's the case, then you may not want to take probiotics until you've actually killed a lot of the other bad bacteria that are in there that are causing this crowding, because right now it's just too crowded. So you want to kill those, and then you'll be able to add more of the good bacteria back in. It's kind of like, imagine a garden with a bunch of weeds. And so if it's got all those weeds and you go and try to plant seeds in there, that's just not going to work, right? You got to remove the weeds first. So similar concept here. All right. Let's see. And again, thank you for everybody's thank yous. I'm glad you found this helpful. I think that's it for our questions. So these were just wonderful questions, by the way. So thank you for being such an attentive audience. I truly wish you all the best, good luck, and I hope you find what works for you. Feel free to call our office, for further information. And as mentioned earlier, you will be getting a recording of this webinar within this next week. Okay, take care and good luck to all, good health to all. Bye-bye.